Dr. Tedros Adhanom Ghebreyesus was elected WHO Director General for a 5-year term by WHO member states at the 70th World Health Assembly in May 2017. In doing so, he was the first WHO Director General elected from among multiple candidates by the World Health Assembly, and was the first person from the WHO African region to head the world's leading public health agency. Born in the Eritrean city of Asmara, Dr. Tedros graduated from the University of Asmara with a Bachelor of Biology, before earning a Master of Science, MSc, in Immunology of Infectious Diseases from the University of London, a Doctorate of Philosophy, PhD, in Community Health from the University of Nottingham and an Honorary Fellowship from the London School of Hygiene and Tropical Medicine. Following his studies, Dr. Tedros returned to Ethiopia to support the delivery of health services, first working as a field-level malariologist, before heading a regional health service and later serving in Ethiopia's federal government for over a decade as Minister of Health and Minister of Foreign Affairs. As Minister of Health from 2005 to 2012, he led a comprehensive reform of the country's health system, built on the foundation of universal health coverage and provision of services to all people, even in the most remote areas. Under his leadership, Ethiopia expanded its health infrastructure, developed innovative health financing mechanisms, and expanded its health workforce. A major component of reforms he drove was the creation of a primary health care extension program that deployed 40,000 female health workers throughout the country. A significant result was an approximate 60% reduction in child and maternal mortality compared to 2000 levels. As Minister of Foreign Affairs from 2012 to 2016, he elevated health as a political issue nationally, regionally, and globally. In this role, he led efforts to negotiate the Addis Ababa Action Agenda, in which 193 countries committed to the financing necessary to achieve the Sustainable Development Goals. Prior to his election as Director General of WHO, Dr. Tedros held many leadership positions in global health, including as Chair of the Global Fund to Fight AIDS, Tuberculosis, and Malaria, Chair of the Rollback Malaria Partnership, and Co-Chair of the Partnership for Maternal, Newborn, and Child Health Board. After taking office as WHO Director General on July 1, 2017, Dr. Tedros initiated the most significant transformation in the organization's history, which has generated a wide range of achievements. New strategy. 1 year after Dr. Tedros's election, at the World Health Assembly in 2018, WHO member states adopted the 13th General Program of Work, GPW13, a 5-year strategic plan with an emphasis on delivering a measurable impact in countries, to support countries in attaining the health-related targets in the Sustainable Development Goals. WHO's work was built on a new mission statement, to promote health, keep the world safe and serve the vulnerable, and the ambitious triple billion targets, 1 billion more people benefiting from universal health coverage, 1 billion more people better protected from health emergencies, and 1 billion more people enjoying better health and well-being. Transformed WHO. To enable WHO to support countries to deliver on these targets, and in close consultation with WHO's regional directors, Dr. Tedros led the development of a new operating model, aligning the organization's new structures and ways of working, and across the 3 levels of the organization, headquarters, regional offices, and country offices. To support the new operating model, several new divisions were established, including the Division of Science, the Division of Data and Delivery for Impact, and the Division of Emergency Preparedness. New processes. To make WHO more effective and efficient, 13 core processes were overhauled or initiated, in 3 areas. Processes relating to technical work like data, norms, and standards and policy dialogue. External relations processes such as resource mobilization and communications. And processes relating to management and administration, including planning and budgeting, supply chain, recruitment and performance management. New culture. Strategies, operating models, and processes will be ineffective without a talented and motivated workforce to implement them. These values drive everything WHO does, from recruiting new talent to evaluating performance, to training leaders and managers, and considering staff for promotion. Under Dr. Tedros's leadership, who achieved gender parity in its senior leadership for the first time, and initiated a new program to pay interns a stipend. Training and equipping health workers worldwide has been a priority area of work. Work is ongoing to launch the first WHO Academy, which aims to offer new and more effective methods of training, in multiple languages, across many areas of health to working people. Under Dr. Tedros's leadership, WHO has also engaged staff in defining a new values charter, which identifies the 5 key values that are at the heart of who we are: public service, technical excellence, integrity, collaboration, and compassion. New approach to innovative partnerships. To achieve the ambitious targets in GPW 13, a new approach to partnerships is essential. Under Dr. Tedros's leadership, WHO has strengthened its relationship with traditional multilateral partners through the Global Action Plan for Healthy Lives and Well-being for All, and expanding its engagement with civil society. WHO has also sought to complement its technical work with increased political advocacy to high-level political commitment at international and national levels, for example through the G20 and G7. Recognizing health for all requires partnership at all levels, and between all sectors of society. Dr. Tedros has worked to engage stakeholders from a broad range sectors, from civil society and government, to the private sector and beyond. This approach to diversifying partnerships has brought up new ways of working, resulting in tangible gains. Processed food manufacturers have committed to eliminate industrial trans fats from their products to protect people from associated non-communicable diseases. WHO has worked closely with digital and social media giants to more actively promote evidence-based health advice, from the value of vaccines to preventing and controlling infectious diseases. Manufacturers of medical supplies joined with WHO to scale up access to personal protective equipment for health workers on the front lines of the COVID-19 pandemic. Multilateral and health partners joined with WHO to develop and drive equitable access to vaccines, diagnostics, and treatments through the Access to COVID-19 Tools, ACT, Accelerator Initiative. To address the constraints facing WHO to generate increased flexible resources for supporting the delivery of critical health services around the world, WHO has launched a series of strategic actions. These include the organization's first investment case laying out the impacts on global health and development that WHO could achieve if fully financed, the inaugural WHO Partners Forum in 2019, and the launch of the independent WHO Foundation to open opportunities for increased partnership in funding public health activities. WHO has also branched out into innovative partnerships to reach audiences it hasn't before, for example with FIFA and Google Fit. Dr. Tedros is globally recognized as a health scholar, advocate, and diplomat with first-hand experience in research, operations, and leadership in emergency responses. He has published numerous articles in prominent scientific journals and received awards and recognitions from across the globe. These include receiving honorary fellowships from the London School of Hygiene and Tropical Medicine, 2012, and the Royal College of Surgeons of Ireland's Faculty of Nursing and Midwives, 2020, and honorary doctorates of medicine from the Faculty of Medicine at Umeå University, Sweden, 2018, and the University of Nottingham and Newcastle University, both 2019. Dr. Tedros has also received multiple national and institutional recognitions, including becoming the first non-American to be awarded the Jimmy and Rosalind Carter Humanitarian Award in 2011 in recognition of his contributions to public health, the decoration of the Order of Serbian Flag in 2016, the Danida Alumni Prize of Denmark's Danida Fellowship Center in 2017, being made a Grande Officier of the National Order of Benin, L'Ordre National de Benin, in 2018, the L'Ordre National du Lion of Senegal in 2018, the Oswaldo Cruz Medal of Merit, in 2018, in recognition of his services to public health in Brazil, the Grand Cross of the Equestrian Order of Saint Agatha from San Marino in 2019, the Bridgemaker Award of the August 14 Committee of Norway in 2020, 2020 Human Rights Award of the Spanish Law Bar, Consejo General de la Abogacía Español, one of Time magazine's 100 most influential people of 2020, the African of the Year Award for 2020 of the African Leadership magazine, and Global Health Leader Award presented by MREF Health Africa in 2021. Tedros Adhanom, born March 3, 1965, Asmara, Ethiopia, now in Eritrea, is an Ethiopian biologist and public health official who was the first African to serve as Director General, 2017, of the World Health Organization, WHO. During his tenure with WHO, he worked to accelerate progress against diseases that affected millions of people each year, including HIV/AIDS, malaria, and tuberculosis. He was known in particular for his responses to the 2018-20 Ebola outbreak in the Democratic Republic of the Congo and to the COVID-19, coronavirus disease 2019, pandemic, in which he led efforts to establish transparency and international cooperation to control the spread of disease. The way in which Tedros worked with governments to secure transparency on disease was at times controversial. He was criticized in particular for overlooking affronts to human rights, including censorship and repression, in his efforts to coax cooperation from authoritarian governments. Tedros was raised in the Tigray region of Ethiopia, the country's northernmost area. The region was heavily affected by civil war during Tedros's youth, and diseases such as malaria and measles were prevalent. Tedros studied biology at the University of Asmara, where he completed a Bachelor of Science degree in 1986. He then served briefly as a junior public health expert for Ethiopia's Ministry of Health before attending the University of London, where he studied immunology of infectious diseases and in 1992 earned a master's degree. He completed his studies in 2002 with a PhD in community health from the University of Nottingham. By the time Tedros finished his doctoral studies, he had already been appointed head of the Tigray Regional Health Bureau. In 2005, after serving as a deputy health minister, he was promoted to Minister of Health of Ethiopia. During his time leading the country's health system, he implemented reforms and secured investments that ultimately helped improve healthcare infrastructure and broaden healthcare access for Ethiopians. In 2012, Tedros was appointed as Minister of Foreign Affairs for Ethiopia. In this position he played an instrumental role in drafting part of the Addis Ababa Action Agenda, AAAA, a framework for advancing Africa's economic, social, and political progress, and in coordinating a response to the 2013-16 Ebola outbreak in Western Africa. In 2017, after being elected Director General of WHO, Tedros sought to improve the organization's transparency and responsiveness and to bolster its resources. With global health challenges increasing in complexity, many experts agreed that WHO needed to overcome its tendency for slow bureaucratic-driven responses to health crises. In his first years at WHO, Tedros demonstrated an ability to persuade authoritarian governments to share information on outbreaks, helping advance international public health relations. However, his praise for authoritarian leaders who made progress toward more effective disease control and especially his tendency to seemingly ignore the deprivation and harm that those governments inflicted on their citizens was a source of controversy. In particular, Tedros was criticized for his support of disease control measures implemented by the Chinese government during the COVID-19 pandemic. Health experts noted that China had mismanaged the disease early on, allowing it to escalate into a global outbreak, and claimed that Tedros did not act soon enough to prevent its spread out of China. Thank you for watching this video.